大家好，欢迎收听 Kidney Plugged In。在今天的节目中，我们会向您介绍肾健康基金会的志愿者 Annick。他是一名 Okanagan 志愿者，也是 Warm Your Soul 项目的策划者之一。Warm Your Soul 项目的主要组织给 Kelowna、Penticton 和 Vernon 地区正在接受血液透析的肾脏病人捐赠袜子和羊毛托克帽。每年2月份是心脏健康及中风宣传月，在您是否知晓部分中，我们会讲述肾脏疾病和心脏疾病之间的联系。更多的活动请关注 Kidney Plugged In。
I'm so pleased to welcome back to Kidney Plugged In somebody that many of your viewers are going to be familiar with when you see her. She's a kidney transplant recipient. I think 22 years ago she got her kidney transplant and really has been a Kidney Foundation volunteer extraordinaire, being involved in so many campaigns. And today she's on the show to talk about a new initiative in the Okanagan area that she is organizing and coordinating. I'm so pleased to be welcoming back to Kidney Plugged In, Annick Lin. Hi, Annick.
Thanks for having me, Barb. I'm so happy to be here. Talking about the Warm the Soul campaign is something that really means a lot to me. It reminds me of before I had my kidney transplant, my feet were always cold, and I remember a friend gave me a big, thick pair of warm socks for Christmas. And I literally remember that to the day because I wore those socks out till they had holes in them. It made a big difference in my life.
So I'm taking the name Warm the Soul. There's a little play on words there for this campaign.
It's a bit of a pun, right? We're trying to reach the kidney patients, the dialysis patients, specifically that are going in center, in hospital, warming their soul, but also warming the soles of their feet.
That's terrific. And it's actually so apropos for February, right? It's the month of warming hearts, Valentine's.
It's good timing. It's cold out. Everybody's got cold feet.
So you were saying, actually, this idea came up because of what you personally experienced yourself.
That's right. So I have had my kidney transplant for 22 years. And I remember pre-transplant, I had a very best friend and he surprised me with big, thick socks for Christmas. And I was surprised. I guess it's something that you really get used to having after a while. I probably mentioned it. Oh, my feet are like icicles. I've got ice cubes in my feet. Whatever the case was, and he thought to get me big, thick, warm socks because I was confused at first. And I said, why would you get me these giant socks? And he said, your feet are always cold. And I said, you're right, my feet are always cold. And so another volunteer in the South Okanagan, Teresa Atkinson, and Vivian Short, they both participated in giving out the socks with me over the past few years. I started it in 2018, and Teresa and I used to deliver Mandarin oranges and candy canes once a week for the month of December to all of our dialysis patients. And so I thought, I love this idea, but they're peeling the candy cane, they're putting it in their mouth, they know it's from Kidney Foundation, but long term, how can we get them to remember who they got it from? How can we get them something that's going to last longer than that 2-minute Mandarin orange? And I work at at a sports store, and I get a great discount off of retail pricing. And I saw these socks, and I thought, I sell a ton of these because a lot of people have cold feet. And I thought, how can I make it affordable? Made a proposal to the Kidney Foundation and said, can I buy socks for every patient rather than candy canes and Mandarin oranges? And so that was approved, and that's where it started. I thought, warm the soul, but not only that, warm your feet, warm the soles of your feet.
Just hearing about this, it really is a genuinely thoughtful initiative. It really
Right.
is a great example in a way of paying it forward, right? This happened to you all
Yes,
years
yes.
ago.
I experienced it myself. That being said, I saw kidney patients after the fact because we went into the hospital and hand-delivered them and said, I want these people to realize that I'm not only a volunteer, but I'm also a patient. Like, look, okay, I've never done dialysis myself, but I have been sick. I was just about to go on dialysis when I got my transplant. In fact, they wanted to do a session of dialysis, but being young, naive, uninformed, uneducated, I really didn't know how critical it was. I really didn't know how sick I was. This is a long time ago, and the machines are very intimidating. You have to sit there and kind of almost not move very much because on one arm you have the dialysis going on, and on the other arm you've got your blood pressure cuff to make sure that you're not going to be sick in some way, and you're hooked up to the machine. You can't get up and walk around whenever you want. So it's a hissing machine. It's intimidating, especially when you're not familiar with it.
Annick, I know, knowing you, you're from the Okanagan area, Penticton, I think, right?
Right.
Tell us about where this initiative is taking place. Where are you going to be delivering?
So for the past few years, we've been delivering to Penticton Regional Hospital. And this year I thought, we're really missing a lot of patients, especially in the Okanagan, because that's where I am. And I thought, can we expand our project? And so when I made a proposal this year, it wasn't just 40 some odd socks. I suddenly need over 200 pairs of socks. But that just goes to show you how many kidney patients are out there, most of them waiting for a kidney transplant. So that being said, it's eye-opening. 10% of the population has kidney disease. So don't be surprised when I give you those numbers just for our little area. And there's a lot of people who are doing dialysis from home, so it's not even counting them. So we've expanded our project this year to include Penticton. We're also going to Kelowna Regional Hospital, and we're going to Vernon, and there's also a dialysis center in Rutland. And so everybody's going to be getting socks. And one thing that I was made aware of that I'm not diabetic, I've not lost a limb. Of course, it didn't occur to me before. People who are getting socks who are amputees are not going to get use out of our socks. So we have this year started including toques into our program. And so we made sure that we get the nurses in advance to go around and see, would you prefer a pair of socks or would you like a toque?
What a great initiative, Annick, and I love the addition of the toques this year. It kind of got kidney patients covered from head to toe.
您是否知道心脏疾病和肾脏疾病之间存在的关系呢？您的心脏和肾脏是您体内两个独立的重要器官，它们共同努力来维护您的健康。当一个出现问题时，另一个也会受到影响。当您患有心脏病时，心脏是无法正确地完成泵血的过程，这时心脏内就充满了血液，这些血液会堵塞与肾脏相连的主静脉，而形成压力，导致肾脏供氧不足，最终就会产生肾脏疾病。受损的肾脏会释放过多的酶，这些被称为肾素的酶会影响血液，这就会增加心脏病、充血性心力衰竭和中风的风险。实际上，肾脏疾病和心脏疾病具有许多相同的风险，例如糖尿病和高血压。因此，切记患有肾脏疾病会直接增加您患心脏病的机会。当然，患有心脏病也会直接增加您患肾脏疾病的几率。希望我们分享的信息对您与您的健康有所帮助。
Just talking about your personal situation, because you are a kidney transplant recipient, and with COVID-19, that has meant an adjustment to your life as well. You're not working. You're one of the fortunate people that has a very loving spouse to support you, but you also recognize the fact that that's not always the case. And you're doing something about that. You're from home and you're coordinating this in order to provide some support for other kidney patients. That must be a very motivating feeling for you in getting involved with something like this.
It's not only about this year specifically, it's not just about reaching out to the patient and saying, Merry late Christmas, here's your socks, here's your toque. When I started this initiative before, I never once thought that I was going to put, if you are really, really low, here's the number to the crisis line. But it's on there because we're very cognizant that the isolation can be very hard on one's mental health. And it's very important, for myself, it's really important to have at least one phone call or one Zoom call or just like a messenger video chat a day, because that lifts my spirits. And so for someone who doesn't necessarily have a spouse, call your kids, get the grandkids on video somehow. I think a pet is really good for the soul, because when you get home, they're so happy to see you most of the time, especially a dog. But if you have a really loving pet that wants to sit on your lap, that's always so good for the soul too. It's so critical to reach out to your family, to your caretakers if you need the extra help. And we want to let them know that the Kidney Foundation is there too to support them through our programs, like through peer support, Kidney Connect, kidney calls, which is a new thing that we started this year too. I think that we were ahead of a lot of charities, quite honestly, because someone posted for another charity and I thought, we've been doing that for 3 months already. I'm not doing it myself, but we have other volunteers that are doing the initiative with calling patients and making sure that we're checking in and making sure that they're doing okay.
Hi, just calling to see how you're doing today. Oh, that's great.
And so
Really nice.
giving them the option, can I call you in a week? Would you like me to call you in a month? What can I get you? How can I help you? And it's so critical to encourage kidney patients, their caretakers, their family members, to really reach out and get the help that you need, because it's not just about the patient, because kidney disease affects families. When you have a family member living in your home who has kidney disease, it affects everyone.
And this is another great example of just hearing that voice or receiving that item or something that says, we're here for you.
It's a small token.
You were saying there's the message on the socks as well.
The message we're trying to get across with our sock delivery this year is to be particularly cognizant of taking care of your mental health, making sure that you're reaching out and getting the help that you need. When you're at the hospital getting your dialysis treatment, make sure to tell the nurse that you'd like to speak with a social worker. Make sure to tell the nurse if you're having a problem and get the social worker to help you in that way, or reach out through the Kidney Foundation and set up what you need. Set yourself up for success. There's a light at the end of the tunnel. This will come to an end. You'll be able to visit your family and your friends soon.
Annick, this has just been so interesting, and we touched a little bit upon your journey, but I'd love to hear more about your personal journey with kidney disease. Can you stick around for a few minutes and join us a little bit later in the show?
I would love to.
So please stay with us, because Annick's going to join us later in the show to talk about her personal journey with kidney disease and her kidney transplant.
3月是肾脏健康月 ，Princeton 小镇正在举行大型庆祝活动。筹款活动将以纪念肾脏健康月为目标，并同时纪念 Cara Lewis 的筹款传统。Eureka，Princeton 社区的一个超市将是所有特殊活动的中心。 各式娱乐活动包括50/50抽奖、多项抽奖，甚至有机会购买在 Eureka 店面橱窗中展示的圣杖森林，我们的吉祥物。因此，如果您在 Similkameen 地区旅行，请停下来说声您好，并支持和参与我们敬业的志愿者团体，还有我们美好的筹款活动。如果需要更多信息，请联系 Sandra EurekaEverythingStore@gmail.com 或 Randy.Spensley@kidney.ca.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.
Annick, welcome back to Plugged In. I couldn't let you go without sharing your personal journey of kidney disease that led to transplantation. Can you talk a little bit about that with us?
Yeah, certainly. I was finally diagnosed at 18 months of age. So I was a sickly baby. You know, the doctors were telling my mom, oh, she has an ear infection, or, you know, whatever they thought it was. We're talking 1976, 1977 at this time. And so my condition specifically, you can see on a prenatal ultrasound. However, again, going back to 1975 when I was born, you know, it's not something that was necessarily done or something that was seen. So it's a birth defect that I have. I was finally brought to sick kids in Toronto. They finally realized what was wrong, and they did a surgery to try to repair my ureters. However, it was not a successful surgery. So I'm very prone and very, I'm delicate. I'm very, very sensitive to urinary tract infections. And so that being said, I'm just extra careful. You know, there was a year where I think I had more than 10 urinary tract infections. And so for myself specifically, when I have a urinary tract infection, I'm down for the count. Like I cannot function, I cannot go to work. It feels, I describe it as an attack. It's very painful, very uncomfortable. So with every urinary tract infection that I had growing up, it managed to, it causes scar tissue. Every time you have an infection, it causes scar tissue. And so my native kidneys don't look like nice, bubbly kidneys. They kind of look like fists. And so I was able to get my kidney transplant in February of 1999 from live donor, who is my dad. And so I'm 45 and my kidney is 70.
随着2021年的悄然来临，加拿大肾健康基支学会 KFOC Kidney Foundation of Canada 携程邀请您参与由我们策划和组织的社区活动。现在就来看看关于这些活动的简单介绍吧。欢迎游览我们的社区活动日历 Community Calendar， 请预留您的时间。2021年3月9日星期二至3月11日星期四World Kidney Day 免费共享虚拟论坛，主题美好的生活与肾脏疾病 Living your best life with kidney disease。 此论坛是由加拿大肾健康基支学会 KFOC 下属 BC 和 Yukon 分会与肾病患者合作举办，患者及家人 医疗保健专业人员和研究人员将在本论坛中分享与肾病防治和保健有关的信息，旨在启发大众意识，增强民众对肾健康的了解。有兴趣的小伙伴请发邮件到 kidneyprogram@kidney.ca 领取邀请函。2021年3月13日星期六，第9届 Virtual Kidney Gala 主题光明的未来 A Bright Future。 第9届 Kidney Gala 将在线上举行，此次盛典主要募集资金和提高大众对肾脏疾病和其危险因素的认识。主题光明的未来 A Bright Future 向我们展示先进科学技术的应用将对人类和社区健康生活产生巨大的积极影响和支持。此次盛典体验将是独特和创新，且一如既往的，我们会把具有正能量和感染力的节目直播到您家中。此次节目是由 Fred Lee 主持。
It costs about $1,000 to send a kid to camp.
他是温哥华节目 Man About Town 的著名主持人。还有什么更精彩的节目？线上直播募集资金活动怎么样？ Kidney Gala 活动项目包括线上无声拍卖、娱乐表演、励志演讲、名酒拍卖及门票抽奖。直播链接将会在节目开始之前发给持票人。通过网络模式，我们希望可以联系更多全国的 Kidney Community。对我们的 Kidney Gala 有兴趣或希望购票的小伙伴，请访问 www.kidneygala.com。 同时，线上 Kidney Walk 活动将在2021年6月7日重磅回归，欢迎您参入 Kidney Walk， 并向肾病患者表达您的支持和祝福。BC、Yukon、Alberta、Territory 和 Saskatchewan 的小伙伴们可以在当地社区里参入 Walk the Block 的活动。
Singing in the rain. And why are we singing in the rain? Because we're walking for the kidneys. Woohoo! We're walking.
我们需要您的支持，请迈出第一步，立即注册 www.kidneywalk.ca。
So I'm going to ask you before you go, if you have any words of wisdom, anything for kidney patients, transplant recipients, pre-transplant out there that you might want to share, some parting words, some thoughts as everybody faces these challenging times right now.
Yeah, it's really hard when you have an invisible illness and you're that 1 in 10 Canadians that has kidney disease. You're going to get that comment from strangers, family members, your loved ones. They'll say it to you, but you look fine. But you know what? Kidney disease is, it's a really good looking disease because I make it look good. You know, I get that all the time. However, you do it too. You know, like if you're a kidney patient out there and you get that, that's because you're living your life. You don't have a choice. So be gentle on yourself. Don't push yourself over. Don't take it to heart when people say that, and get them information. You know, if anything, educate your family and your friends of why you're not feeling good today, or why, you know, pre-transplant, believe me, I was taking those 2-hour naps every day. And when I got home from transplant, I said, okay, I'm gonna go for a nap. And I laid there with my eyes like saucers. No way, I'm full of energy. I can't sleep anymore. So that being said, if you're on dialysis right now, or if you've just been diagnosed, or you're a veteran like me of kidney disease, you know, any situation that you're in, encourage your family members and your loved ones to educate themselves, help them educate themselves, and make them realize that, you know, you're living life to the best of your ability, but you're not going to feel great every day. It's just not possible. We all have our downtime, right?
Let's see. So, kidney These are my grandpa's kidney stones. They're very precious. Kidney is a bone in your back that helps you turn. I don't know, to be honest.
They don't know kidneys are vital, do you? Get the facts at kidney.ca.
I want to thank you for doing such a genuinely thoughtful, wonderful initiative in your region. And thanks for coming on Plugged In and sharing it with us. It's been so great to see you again. And, congratulations on the success of this initiative.
Thank you so much, Barb. I want to make sure to include my team. I can't do this by myself. Number one, I've known Teresa since the first day that I attended my very first kidney walk. And so Teresa Atkinson is another volunteer and another kidney patient. And also Vivian Short, she's the one who created the Kidney Connect, calling patients. I had Vivian over the other day for about 3 minutes. We took pictures with socks and we literally clink, clink socks like champagne glasses. We were 6 feet apart. Teresa and Vivian and I, we do 2 Zoom calls a week. And half the time we're talking about Kidney Friends Circle. That's the new project on Facebook. And the other times is they're helping me with writing the letters. And, I can't do this alone. And so the South Okanagan chapter, Vivian, myself, and Teresa all had a big part in creating this project this year.
Annick, thanks again for joining us.
It's been my pleasure. Thanks for having me.
Thanks to all the car donations made to the Kidney Car program, the Kidney Foundation of Canada can help all these people with kidney disease. Those donations are instrumental in providing them with care and invaluable support. When you give your car to the Kidney Car program, it will be towed for free and recycled or resold. You'll also receive a tax receipt of at least $300. To continue to improve the quality of life of thousands of patients, we need your car today.
But yeah, you just don't pee. So let's say that you drink a 6-pack of beer because I know you so well. Just kidding. Just people can be so.
Oh, pun, kidney, urine.
Urine.